Hi, this is Group 4. I'm Carolyn Rosner. We're going to be talking about a system in name only, access, variation, and reform in Canada's provinces. We're going to provide a background, our research and analysis, key findings, some best practices, and ultimately our learning and recommendations. Canada's universal healthcare system, Medicare, is a pillar of Canadian identity. They provide universal coverage, which means no out-of-pocket cost for essential medical services like doctor and hospital visits. There's no copays and no private insurance actually allowed for procedures that are covered under Medicare. There are some significant limitations to note, however. There's a narrow scope of services covered under Medicare, and they leave out things like outpatient care, subacute care, and about 50% of prescription drug costs. Canada is a high-income country with a population of 33 million. They spend less per capita on healthcare than the United States, yet perform better on indicators like life expectancy, obesity rates, infant mortality, and amenable mortality. Universal hospital insurance was initiated in 1947 and universal medical insurance in 1962. Both of these started in Saskatchewan and spread out through the provinces, ultimately harmonized in the federal law, the Canadian Health Act of 1984. Canadian healthcare is less a national system and more a decentralized collection of provincial insurance plans that cover a narrow scope of services free at the point of care. Healthcare delivery is left up to the provinces and territories. Spending and outcome vary significantly between provinces, and while there are superior outcomes overall, there are a few things to note, including poor access to urgent outpatient care, which results in high ER utilization, and also significantly inferior outcomes for the 1.7 million Indigenous people in Canada.
This was a correlational research project which compared statistics between measures of healthcare quality, including cost and outcomes of the healthcare systems of the United States and Canada, in order to determine healthcare practices that may benefit from import to the United States and export from the United States to the Canadian healthcare system. 5 researchers performed separate searches and decided on the relevance of each article. Quantitative secondary data was gathered from various online sources, including PubMed, Google Scholar, and the Johns Hopkins Sheridan Library database. Search terms included health, Canada, and policy. Inclusion criteria included articles on human healthcare, articles in English, and articles written within the past 5 years. Exclusion criteria included articles older than 5 years old and any articles not in English. Side-by-side comparison between relevant outcomes in the U.S. and Canada were evaluated along with correlating healthcare policy to determine which initiatives should be imported to the United States from Canada and which should be exported from the U.S. to Canada. No statistical analysis was done for any variable during this project.
To key findings, at very high level, Canada has a decentralized healthcare system supporting universal coverage that's sectioned in 3 layers. And then you can see on the right side of the slide, there's layer 1 that's publicly funded, that's supporting hospital and physician care. But then there's layer 2 that's a mix of public funding and private insurance, and it covers services like outpatient prescription drugs, home care, and long-term care. Then there's also layer 3 that's private insurance, and that's covering services like dental, vision care, and outpatient physiotherapy. Talking about key features of Canadian healthcare system, you can see that on the bottom left of the slide. So it's a single-payer system that's supported by 70% public spending, and is delivered primarily through private professional facilities, and healthcare largely means hospital and physician care. And that you can see from their core layer, that's layer 1, that's the publicly funded layer. And healthcare beyond hospital and physician care varies quite significantly across provinces. In comparison to other OECD countries, it's overall ranking second last in table of 11, so just above US. And it's at bottom 3 on measures of safety, quality, and access. And out-of-pocket spending is also quite high. It's 14%, which is quite high compared to other OECD countries. So during our research, we identified some key issues and positives for the Canadian healthcare system. So the main problem with the Canadian healthcare system is access and cost rather than expanded coverage. And there are some issues that we identified, and it's pharmacotherapy driving out of pockets. There's outpatient prescription medicine not fully government funded, and also there's high variation in physician practice from region to region, and healthcare beyond hospital and physician sectors, it varies quite significantly across provinces. Also, there's a late adoption of modern IT, and there have been many reform efforts to actually fix access and cost, and there are some positives that we identified for the Canadian healthcare system, and yet you can see on the bottom left of the slide. So it's a universal healthcare financed by taxation and public funds, and then hospital setting and physician care are fully covered as indicated in the previous slide, the layer 1. And there have been some good initiatives by many doctors and community centers across different regions in Canada. So there have been many doctors providing non-fee-for-service model in certain regions, and then also there are some community centers that are providing superior care to high needs patients. And last but not the least, you can choose any primary caregiver. So again, at very high level, we're positioning Canadian healthcare as an underachiever. Therefore, we can consider it good but not great.
Now let's talk through the opportunities for innovation between the US and Canada. Just a caveat, there are many similarities between them, but there are also many cultural, political, historical, and social differences that may make it difficult to apply the exact same interventions in both places. So the first innovation that could be exported from the US to Canada is required essential health benefits. The Affordable Care Act requires American insurers to cover 10 categories of services, including emergency services, prescription drugs, mental health, and more. That is not the case in Canada, where the government covers hospital care and physician care. Beyond those two, it depends on the province you live in. Prescription and mental health services are not always covered, and The Economist found that 63% of Canadians get private insurance to cover additional care. If you take the example of mental health, more than 80% of Canadians feel that mental health services are underfunded, and the government should fund it at the same level as physical health. If Canada had a list of essential health benefits, standardization of vital services could potentially help avoid gaps in coverage. The second innovation is a value-based payment model. The U.S. healthcare industry has made large leaps towards testing these models, experimenting with ways to reimburse providers and incentivize them to offer integrated high-quality and low-cost care. A 2019 Change Healthcare study found that nearly all U.S. states, 48 in fact, have implemented value-based care programs. Canada, on the other hand, still has largely fee-for-service with limited value-based innovation. The Economist found there's only moderate implementation of value-based healthcare initiatives in Canada. Although individual provinces have made some efforts to redesign payment and shift away from fee-for-service, there is no national policy, and Canadian providers are not trained in how to practice within these models. As we saw earlier, Canada's system could benefit from quality improvement in various areas, and exploring value-based payment models could be one way to achieve this.
Hello. After researching Canada's healthcare system and how it compares to the United States, we've identified 3 different areas that the United States can learn from Canada and possibly implement within our country. The biggest area of interest is the concept of making healthcare a right and accessible to every citizen regardless of race, ability, or income. We've learned that Canada has an approach to healthcare that overall increases the health of the country as they focus on the concept of universal healthcare and ensuring that its citizens are receiving proper care. Additionally, Canada provides educational services to its citizens in regards to their health and safety, which allows each individual to be proactive and knowledgeable on their health and therefore results in better health across the country. Lastly, Canadians are known to appreciate their healthcare system, and they have a positive attitude and outlook towards their government. We can learn from Canada how an effective healthcare system can provide and improve our attitude and increase our national pride. Thanks.
Hello everyone, Brandy Torres here to wrap up the key learnings from this assignment. First, all stakeholders need to be considered and their interest addressed during healthcare policy. Prevention and improved primary care focus can improve healthcare in the United States. Poor healthcare drives up costs for small populations of high utilizers in both the United States and Canada. An integrative healthcare system improves quality and costs. Even though the United States spends a higher amount of the GDP on healthcare than Canada, increased spending does not improve healthcare quality. Improving the current healthcare system is mainly a political problem. This ties into the next point of cultural considerations. Healthcare in the United States is not considered a right of the people, while healthcare in Canada is considered a right of the people.